Thanks for expressing interest in the platform. Today, I'm going to walk you through our ePrescribing portal. And keep in mind, we really offer 3 value adds. One is clean documentation. We'll make sure the facility only sends you an order after they've completed all the necessary steps to eliminate the back and forth. 2, we provide communication. You can chat in real time at a patient level with the facility through our HIPAA compliant chat. 3 is visibility. Rather than faxing an item, the facility can now track an order start to finish the same way they do on Amazon or any other site. Let's walk through the portal. I'm going to start off from the facilities view. The facilities view here is going to be SuperCare Health, a mock hospital. This is their dashboard, and you can see all their patients' orders. An order starts in progress, which means that the facility started to place an order. Once they've got all the necessary documentation filled out and they've gotten it e-prescribed by the doctor, it gets sent over to supplier, and the supplier reviews order here. The last step is preparing for delivery, at which point we map directly to your Brightree or Brightree equivalent to get the delivery status automatically sent into Parachute. This way, you don't have to get a phone call asking for an update on the order. Let's just hop into an order. I'm going to start this order as if we have an EMR integration with this facility, which means we can pull all the demographic information automatically and nobody has to deal with writing that down or typing it in. So I'll search for my name, hit create new order. This starts a new DME order, and you can see it pulls in my insurance, phone number, address, and later on my doctor's number, MPI number, name, ICD-10 codes, etc. You can see here that all this information looks good, so I can continue with the order. Payment section's complete. There's a green box here, and we'll move on to product. For simplicity's sake, I'll do a wheelchair here, and I'll do a heavy-duty wheelchair. Height and weight shows up from the EMR automatically. I can change it if I need to. Length of needs 99. I'll just save that off. Seat size 22 by 16. No accessories for this, so I'll just save it and add it to my shopping cart. So the product section's done. We're going to deliver it to the patient's billing address, and we'll double check that we chose the correct supplier here, Parachute Health DME. I'll continue with the order. This is just delivery information. So patient's phone number's here, the delivery date, let's say it's 7/10. Delivery notes, deliver before 3 p.m. if possible. Emergency contact comes in from the EMR, and we can move on to the clinical information. If there are diagnosis codes associated with the patient, they'll come in from the EMR as well, but I'll put in difficulty walking here, and I'll create a mobility chart note. All right, so here's the chart notes page. This is going to ask, essentially, based on the insurance, Medicare, and the product, a wheelchair, what are the LCD requirements that we'll need to fill out? First, it's going to ask the face-to-face, when the doctor saw the patient. Next, it'll ask, what are the ADLs that are impaired by the patient's mobility limitations? This patient can't walk independently or dress. If I said none of these, it wouldn't support the chart note because they do have to have some ADLs that are impaired. So I'll say walking independently and feeding. Now it's going to ask me to describe the patient's mobility limitation. I'm going to say unsteady gait, and you can put additional clinical info here that's specific to the patient. Will any of these other devices resolve their mobility limitations? No. You finish up the questions, hit save, and you're essentially creating a progress note here that acts as an extension of whatever exists in the EMR of the facility. Parachute is a facility EMR. So the last step here is to sign off on this order. So the doctor, in this case Dr. Steve, is going to sign off on it. Before I actually send an email to Dr. Steve to sign off, I'm going to show you what we created here. Here's the documentation that we just created. This is the WOPD with a heavy-duty wheelchair in it. Next is the progress note. This progress note gives all the clinical information that we filled in, as well as the customized information based on that patient. This would also create a CMN if it was an auction order for Medicaid, for example. Let's go back to the screen and get Dr. Steve to email sign this. I'm going to send a signature request to Dr. Steve. He's going to get an email, and you'll see here this order is pending signature. So all we need to do is get the doctor to sign off, and we'll be good to go. If I sort this by most recent order, you'll see it's here pending doctor's signature. So let me just move over to the doctor's view super quickly. And you can see here, this doctor has 2 orders. I can review this order, make sure everything looks good, and as the doctor, I approve it. Now let's go back to the facilities screen. And at this point, supplier's reviewing the order. The facilities work is done. They just have to keep an eye on it and make sure nothing requires their attention. So now if I can move over to the supplier's view, you can see this order just came in. And this is your view as a supplier. Your intake team, your CSRs would be looking at this screen. So I'm going to click on Steve's order. I can now see the entire stream of events here from when the order was created all the way to when it got submitted to me, the supplier. I can write a quick message. And the supplier can now send that message off to the facility. Facility receives an email notification letting them know they have a message. What also shows up is the documentation, but now it's e-signed. At the end here, after reviewing, this is kind of your gate before you send it into your billing software. You can either send it back to the provider. An example of when that could happen is if it's a CPAP order and the provider uploads the incorrect sleep study. Most of the time though, you as a supplier can hit submit, which essentially means submit to Brightree or my Brightree equivalent. At that point, we can take all this information and send it directly into your billing software so that nobody has to type this in. At that point, the order is done. It's in your billing system, ready to be reimbursed. Remember, there's 3 big things at play here. One is the clean documentation. You're getting this documentation created for you, and you're able to review it before submitting it to your own system. Number 2, communication. You can chat directly with the facility at the patient level here. 3 is visibility. You now have insight into all your orders from a data perspective. You can create sales reports and operational reports based off of it, and generally have a lot more organization to your DME orders.